This week, we're talking about all things psychiatric mental health nursing. So join me to learn more about what they do, where they work, how much money they make, and why George Washington University is the very best place you could go to get that next degree. Welcome back to This is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I am a nurse practitioner, and I wear a lot of different hats in my work, including hosting this weekly podcast to bring you news and information on aging, caring for someone living with Alzheimer's disease, and a wide range of topics that I hope will help move us towards becoming an age-friendly world. Because when things are age-friendly, they're friendly for everyone. So if you like the podcast, the best way to help me grow and support the podcast is to like it, share it, and leave a review in whatever platform you've tuned in on today. Because no matter how old you are today, we are all aging, and these issues are going to become increasingly important. If you're a millennial, there are things that need to be in place when you reach the age of 65. So we have about 20 to 25 years to get these things in place to help you age with the support and choices that will help you, just like the people that are 65 today. Your likes, shares, and reviews help get the information out to help more people dealing with these issues. But right now, let's get going on this week's episode. So welcome back to This is Getting Old, Moving Towards an Age-Friendly World. And on today's episode, we're going to be talking about psych-mental health nurse practitioners. And I'm super excited to be joined by two amazing psychiatric mental health nurse practitioners, Drs. Tony Roberson and Cynthia Awadzi. So welcome to you both.
Thank you.
And so before we dive in to what we're going to talk about today, maybe just briefly introduce yourselves.
Hi, I'm Tony Roberson. I am the director of the Psychiatric Mental Health Nurse Practitioner program at the George Washington University School of Nursing. And I'm happy to spend this time with you today. I've been at George Washington for about 5 years now, and I've been in the director's role for about 2. And my background is I'm a psychiatric mental health nurse practitioner, been practicing for approximately 30 years now. And prior to that, I was a mental health counselor in private practice. So my PhD is from the University of North Carolina in Chapel Hill. And my research background has been in adolescent psychiatric mental health, those who are in juvenile justice systems and access to mental health care. So I'm happy to be here today.
Yeah, me too. And I'm going to forgive the fact that you're from UNC as a Dookie.
Got you.
Yeah, but welcome.
I taught there too. So
yeah. And Dr. Awadzi.
Yeah, hi. Thank you for having me. So I'm Dr. Awadzi. I am an alumni, 2 times alumni of GW. I did my family nurse practitioner program here, and then I did my psych mental health program here. I currently live in the DC area. I've been at GW going on 3 years. I started as a visiting professor and recently became an assistant clinical professor. I have worked in outpatient and inpatient setting. My specialty is addiction, and my my research interest is integrating family and psychiatric medicine. And I'm currently a medical director for an addiction facility here in Northern Virginia. And that's a little bit about me.
Okay. Well, that's great. So my background, even though I'm a family nurse practitioner, I've always done geropsych. So that was always part of our clinical practice as well in nursing homes and assisted living. So psychiatric mental health nursing is near and dear to my heart. So let's talk about what a psych mental health nurse practitioner is. Like, what does that specialty mean?
So a psychiatric mental health nurse practitioner, we assess, we diagnose, and we treat the mental health needs of patients, and we treat across the lifespan. We provide prescribed medications for patients. We provide therapy, and all of those patients either have mental health disorders or substance abuse problems. And we are also, we provide physical and psychosocial assessments, emergency psychiatric care and treatment. We work in a variety of settings. The traditional setting is during the day, but there are psychiatric mental health nurse practitioners that work night shifts or they're on call. So certainly a wide range of opportunities in the profession.
Yeah, so it sounds like you can do acute care, you can do primary care,
you could be like doing inpatient stuff, and you do mental health nurse practitioners do anything with home health?
Not a lot, but there are some who are on certain teams of psychiatric mental health professionals who might do some home health work.
So we do telehealth as well, right? So that's usually the patients can be home. So that can be a home health situation, but more of telehealth.
Right. And I think what's interesting about that is a lot of people think about nurses and nurse practitioners as being just within the four walls of a hospital. So I really like to point out, the different environments that nurses and nurse practitioners are in, and while most people are kind of addressing maybe more physical health, you're kind of doing, well, do you do, would you be managing somebody's blood pressure, or you really just stick to the psych mental health piece? I know you as a family nurse practitioner would probably do both.
Right. So that's something I always make sure the students know, the scope of practice. If you are only a psychiatric mental health, then you want to look at the state that you live in and what the criteria is to make sure you practice in that scope. If you're prescribing something, if you're prescribing something that does affect the blood pressure, then absolutely, as a psych mental health, you do want to look at it, or you do want to refer out.
Okay. All right. Did you have anything else to add?
I think that's when that collaboration with other primary care providers is really important. And as Dr. Awadzi alluded to, there are FNPs who also practice as psychiatric mental health nurse practitioner, and they do have that scope of practice to be able to do that. So,
okay. So now let's talk about what a typical day at work might look like for a psych mental health nurse practitioner, if there is a such thing.
I think the typical day really depends on the patient population and your clinical setting. I can speak about outpatient and inpatient. I've worked in both. Outpatient, you're going to see patients for initial intakes, and you're going to see them also for medication follow-up visits. The initial intakes is when we are taking a full psychiatric history of the patient and determining kind of what they're presenting with, and then we get down to the differential diagnoses and then diagnoses and the treatment plan. So, that's pretty involved, and it takes a lot of astute skills to be able to do that. The medication follow-up visits are those visits that are either you're still working with that patient to kind of get them on the right medication or combination of medications, or they're stabilized and you're continuing to work with them and to make sure that they remain stable. So that is really kind of an overview of an outpatient setting. And then an inpatient setting would be more of acute stabilization and working with a mental health team to stabilize that patient so they can move into an outpatient setting. So, and then Dr. Awadzi can talk about the substance abuse setting, because she's much more familiar with that.
Yeah, so I've worked inpatient addiction as well as outpatient addiction, where typically your patient will come through the emergency room. They typically want to assess the patient to see, okay, what unit should a patient go to? Typically, if a patient is more having maybe suicidal thoughts, they will end up in the psych unit. But if they have a significant amount of substance use, which we know COVID suddenly accelerated that, then it will end up in addiction unit. And that's when we do use medications to decrease mortality and morbidity, decrease chances of seizures or things that could really harm the patient, medically stabilize them as well, which even inpatient, we still collaborate with different teams. Example, if we get a patient that's pregnant, we want to get an OB team on board. Or if we get a patient that has liver problems, then we get the liver team on board. So it's just collaboration is everywhere, whether it's inpatient or outpatient. And then the follow-up, right? Because we want to avoid rehospitalization. So we make sure we have a strong follow-up for these patients when they leave us, right? Because we want them to be successful outpatient. So that's typically your regular inpatient, making sure it's higher acuity, making sure you stabilize them before you send them home.
If you're a nurse who's considering going back to school to become a nurse practitioner, I wanted to share 3 exciting opportunities that we have at George Washington University School of Nursing. Our adult gerontology nurse practitioner program in both our acute care and primary care track, as well as our psychiatric mental health nurse practitioner programs. So to learn more, just go to nursing.gwu.edu and submit your application. When you get to campus, be sure to look me up because I'd love to support you in any way that I can as you advance your career in one of these critical areas of healthcare.
So now let's kind of get into what might attract somebody. People follow money sometimes. So what is that kind of the average salary for psych mental health nurse practitioners?
So I can say in addiction, it's money. If you love addiction, it's a good thing. And psychiatric tends to be one of the high-paying jobs among most NPs specialties. So that's something which suddenly guide you. I have students that graduated years ago that used to reach out, Dr. Awadzi, I'm going into this setting. This is how much I'm getting paid. What do you think? Right. So I'm certainly not but I've worked in certain places, attended enough interviews to know the few things that students can do or new graduates can do. But so it also depends on the area. In the Washington, D.C. area, we're not the lowest paid. We tend to, I always tell my new grads, don't accept less than 140. And it's not just because it's psych, right? It's also because they came to GW. Our students are well sought out. So they hit the floor running, and we expect that they do get paid for what they bring into the table. But we also consider the state that they're living in, right? What's the needs and what setting are they going into? So that certainly is very helpful.
Right. And there is a huge national need for psychiatric services, and psychiatric providers have recently had experience of actually trying to find somebody, that could do like teen, adolescent health, adult health. And it's like, nobody's taking new patients, and it's really hard. So access to care is a big thing. So what were you going to say, Tony?
I was just going to add to Dr. Awadzi, one of the incentives of private practice is that you can really, do quite well financially, but you also have that autonomy of being in your own practice, and you can schedule your own time. The downside of that would be, of course, if you're not in practice and seeing patients, you're not making any money. So, but there's a lot of times when individuals really like that, depending on what their family's situation is. Now, in a facility where you're getting a salary, you're pretty much expected to see so many patients a day and to meet kind of a quota, so to speak. I don't ever think it's unreasonable. I've never worked in a place where it has been unreasonable to do that. Our intakes are typically an hour, maybe to an hour and a half, depending on the facility. And then our medication follow-ups are typically between 20 and 30 minutes. So we are incorporating a few other things, a few other modalities within the clinical settings, such as some brief therapy, perhaps. So, and you don't get that in a lot of the other specialties. So, psychotherapy, prescribing medications, and really kind of having more that holistic approach to the patient's care.
All right. So now let's talk a little bit about, you mentioned some of the benefits of why GW. So let's talk about, some of the reasons that someone who wanted to become a psychiatric nurse practitioner, why should they come to GW other than to work with us? Because
I
that's
think
like the number one reason.
I think we can both talk about that. I think we're so proud of our program, and we have some amazing faculty who work and who have really done a lot of groundwork in making this such a reputable and well-known program. Our program covers the lifespan, so that meets the certification guidelines, but we feel like that's important so individuals can come out and they can decide what they want to do, so they're not limited to a certain population. So our program is covering the lifespan from children, adolescents, to adult, to geriatric. So that's really a nice feature that we have. The other benefit for a lot of working individuals is that our program is hybrid. And so we do quite a bit. The vast majority of our program is asynchronous. And so that means that you're not having to meet, with the faculty or with others. You're doing a lot of work on your own, but you do have that support from faculty on a daily basis, essentially, because we're there to support you and there to guide the students and move them along. One of the other things that's really beneficial for the students is that we have such a strong infrastructure to support online learning at GW, where you don't see that at a lot of other universities. So I think that's kind of what sets us apart from other programs, is that we do have that strong infrastructure to support students that are essentially live all over the country. And so we do have, students that are on the West Coast, the East Coast, and everywhere in between. So that's another really a nice feature for our program. And right. I think one of the last things that I can talk about is the pass rate of our students. It's currently at 100%, and it's been that way for several years now. So we're real proud of that, and we can put that out there. And that's really kind of one of the main goals of completing the program, not only to become a psych nurse practitioner and be able to practice in a competent and confident manner, but also be able to pass the certification.
So, Cynthia, so for you actually have like two different experiences. You have the experience of being a student in this program and now an alumni, but also being faculty. So what would you say are some of the reasons someone should join us at GW?
I'm not even sure where to start with that, but
we'll start wherever you want.
But so we have, and I'll talk a little bit about a student as well as faculty. As a student, you don't only have a clinical instructor, but you also have the course coordinator. You do have a CEF that directly oversees your clinical aspect of it. So it's kind of separate. They're just basically monitoring how you're doing in clinical. If you have a hard day of clinical, if you encounter any clinical situation, you can reach out directly to them. I have been a CEF, so as Tony, and I still am. You can call us, you can email us, and I mean it's getting that assistant on the spot where we feel
what does CEF stand for?
So is the Tony, help me out. Is it clinical education?
Faculty, clinical experience faculty.
Okay.
Clinical experience faculty. So what they do is they basically, every time that you log your clinical note, we're looking at it. We want to make sure that the clinical site that you are currently, it's a fit for you. We want to see what you're doing. That's the only way we can see. As Tony mentioned, our students are all over the world. But we can look at your clinical, what's happening, and knowing that we're a phone call away or an email away, it really empowers you for you to be able to know that what you're learning, we're looking at it, we're monitoring it, we're here to give support, making sure that, if you call us and you say, okay, I don't feel confident or I don't feel like I'm learning, we have other ways to help you, either find a different clinical site with support. I've had to pull many students where they've reached somewhere and they said, I don't feel confident because I'm local. If you're local, then I'm able to help. Bring them into where I work, which I love doing, having students, and most of our faculty do, depending on where you live. So that's one thing as a student that I loved, because I did have the support. I never felt like I was somewhere alone, even though the program is hybrid. So that's number one. Another thing is there's a lot of programs that do not have addiction. Addiction is major because no matter where you work, even if you don't practice you don't plan on working with that population, you're going to encounter it. You're going to meet, whether you're in a hospital, outpatient, wherever you are. What we want is our students, when they graduate and they're practicing, to be part of the solution and not part of the problem. We know many patients that become addicted to substances, it starts with healthcare, right? They got injured, somebody started them on something, and now they have a problem. So our goal is to make sure that our students are out there helping and suddenly not starting the problem or contributing to the problem.
Mm-hmm. And going back to what Tony said about the strength of the online learning infrastructure, this is the third university that I've worked in, and I've never seen like such consistency across not only courses but programs. And so I think we can thank our OLIT department, which was Online Learning Information Technology. Is that right?
Yeah.
So we have a lot of acronyms. So I agree with that. And then the fact that, are there any on-campus requirements? Because hybrid, you mentioned the asynchronous versus synchronous aspect of things, but is it remote and then also they come to campus sometimes? Or is it 100% remote?
It's 100% remote right now, Melissa. We don't have any on-campus activities. The synchronous part would be if we were meeting with a student or a group of students, and that's an option that can be coordinated between the faculty and the students if that's needed. But like I said, the vast majority of our activities in the program are asynchronous.
Yeah, and just to be clear, I mean, that's true for most graduate programs. If you're going to go to graduate school now to become a nurse practitioner of any kind, it's primarily going to be online. It's just some of the specialties have an on-campus where you might come a couple of times a semester.
Right.
But to me, I think that increases accessibility and access for people to become what they want to be. So I know even for my PhD, I couldn't do a traditional doctoral program. And so luckily there were online PhD programs so that I could live in North Carolina and go to school in South Carolina. And we would go down there like 1 week in the summer. And it's like, that's what it took for me to be successful. So I really think that online learning, most newer graduates are used to some online learning because they're, the course shells and the syllabi and everything is in an online learning platform. But if someone's been out for a while, just to be aware that this is just how things are done. But again, I do think that GW excels in the way we structure our learning activities and how consistent we are about how we kind of lay out content between our courses. Because so there is there's some oversight and organization. Whereas I've worked in some schools where everybody was just doing their own thing, and the students were like, "Well, she's doing it that way, and he's doing it that way, and and I'm lost." And so I do think that is a strength, in addition to the stellar faculty and clinical experiences. And I'm sure that we have kind of a national network because we've had students outside the DC metro area. So if even if a student lived in South Dakota, we've probably had a student in South Dakota before, or we have people that we could contact to help transition to like a different clinical site. So if you're not local to GW, there's still support and resources to help students who are farther away. That's correct.
And Melissa, we've had students that something that you said just made me think of our previous students, that we have students now that are working, not only Dr. Awadzi, but also working with us as CEFs. They contact us and they say, "Hey, what can I do? I want to be a part of GW again. And I don't want to get another degree, but I want to work somehow with students and be a part." So they're really happy to be a part of the university again. So there's always opportunities for our alumni. So wanted to put that out there. And I also want to point out that there are 3 ways that a student can enter our program. So they can enter as a postmaster's. So they can go through the postmaster's certificate program. So most of the postmaster's students, they're FMPs, and they want to come back and get the psychiatric mental health specialty. They can, the second way is through from a BSN to MSN or BSN to DMP. So there are multiple ways for an individual to kind of enter into the program.
And I wanted to add to that, there are some schools, even some locally, that when you are in the DMP, the Psych-Mental Health DMP program, that you actually, after you pass your boards for the Psych-Mental Health, you have to finish the DMP before your document is released for you to be able to go work. But our program is not like that. Once you graduate, you pass your boards from the Psych-Mental Health NP program, you can still work and continue your DMP. And that's such an amazing thing, because then you're not waiting for a year or so before you start working, because you want to start working immediately. You want to pass your boards immediately. Because if you wait for a whole year after you graduate before you start working, that can be increase people's ability to hit the floor running.
Yeah. And so just to be clear, so someone who's not all that familiar with nursing and nursing education, what you're describing is kind of like an MSN graduation point. And that is when you're eligible with a master's degree to sit for the license and the certification exams.
Exactly.
Then that means you're able to work and practice with your license while you're going to school to add a DMP. So it's kind of like I went to school and did my bachelor's and master's. Those were two separate degrees. And then later, when I was doing my PhD, did a postmaster certificate and the PhD. So if anybody has any questions about that, we're going to let them know how to get up with you guys so that you can further explain. But I mean, I understand it. And I think that anybody that's been looking at programs for a while would understand that. But I just wanted to be sure that no one thought you were saying that we let people practice without a license.
Oh, no.
So, yeah, there are other schools that even after you have fulfilled all the requirements to graduate with a master's, they're going to retain you in that program until you're done with your DMP before they let you sit for your boards, even though you were eligible to do that a year prior. So they let
you, sometimes they let you sit for the boards, but you cannot work until you finish your DMP.
Mm-hmm.
Yes.
Mm-hmm. Okay. Yeah. And so that's just, that work, the ability to work while you're going to school. Some schools do require that. And I would never have gone to one of those schools because I had 3 kids to support. And, so it is something to be aware of. And I'm glad that we allow students to work, during the program.
Yeah.
All right. So if someone wanted to learn more, what are some different ways that they can find out more about our program and connect with you guys?
You can always access the School of Nursing website and look for the Psychiatric Mental Health Nurse Practitioner Program, and click on that, and it gives you a lot of information about who we are, what we do, and the program of study. And this line is laid out very nicely for you to kind of to review. And I can be reached through my GW email address. It is Tony R. TONYR@gw.edu.
Okay. But probably for preliminary questions about admissions and matriculation and that type of stuff, we have an amazing admissions office. So start with them. But if you have a particular question, that you didn't get an answer from the admissions office, that's when coming to us is a good idea. And what about you, Cynthia?
So the admissions teams also, there's been at least 3 times that I can remember where they have linked a student with an alumni like myself to just give them from a student's perspective, which is great, because there's been times, know that we will give you the honest answer, what we think is good for you. I've had students that seems like they really rather do counseling than the medication side. So then I will give you my perspective. If that's what you want to do, then, this is the portion of counseling we do, but it seems like you want to do more of this. So absolutely reach out if you have specific questions, if you're not sure what you want to do. And you can reach me at cawadzi@gwu.edu, or reach out to the admissions team. They're quick to link you with alumni that they feel fit the path that you're looking into.
All right. Well, thank you both for being here with me, Drs. Tony Roberson and Dr. Cynthia Awadzi. I really appreciate it. And I hope that we see some people who've listened to this episode on campus. Well, not really on campus, but in our virtual campus environment.
Yes.
So, all right. Thank you both for being here with me today.
Thank you.
Thank you.
Bye.
Bye.
Thank you so much for listening to this week's episode. You can check out other episodes on this platform or visit my website at MelissaBPhD.com. Thanks to listeners like you, in the first 18 months of This Is Getting Old, we have reached a ranking of top 10% globally, and I cannot tell you how much I appreciate your support in making that happen. I'm also really excited to let you know that you can now work with me directly, either one-on-one or you can join one of the groups that I coach. Particularly if you're an adult child dealing with an aging parent or a caregiver trying to manage the complexities of someone living with Alzheimer's disease. In the show notes, you can also find information about how to reach out and contact me directly, and I hope to work with each of you very soon as we discover and share more ways to make the world more age-friendly for everyone. My website also has information about how to contact me for speaking engagements, or if you have someone you'd like to recommend as a show guest for This Is Getting Old. If you have a product or service in the aging space that you would like to advertise and or sponsor an episode, there's more information about that on my website. And you can also find books and courses that I developed and learn more about the products and services that I recommend. So don't forget, if you like the podcast, the best way to help me grow and support it is to like it, share it, and leave a review in whatever platform that you've tuned in on today. Your likes, shares, and reviews help increase my rating and my rankings, and also help other people find the podcast. I look forward to reading your reviews and hearing from you.